Nikita. Right. Okay, we are live.
Yes. One second. Okay, so a very good afternoon and welcome to our session on the topic Understanding Anemia in Pregnant Women. We have Dr. Garima Jain, Senior Consultant of Apollo Cradles and Children's Hospital, Marathalli. And today we would understand the topic with all the causes, symptoms, diagnosis, and treatment. Everything we need to know about the topic. So stay tuned till the very last of the session. Also, if you have any doubts, any queries related to the topic, you can post that on the comment section. Our doctor will take all your queries by the last of the session. So stay tuned and ask all your doubts, clear all your doubts. Our doctor is here to help you out. Now, I would request a doctor to take over the stage.
Thank you, Nikita. Thank you, everybody. Um, Hello, everyone. This is continuing with the education for our patients for a better health of our patients. I am Dr. Garima from Apollo Cradle Marathali, like Nikita has introduced me. Today, we are going to talk about anemia in pregnancy. Looks like a very big topic, and you start wondering, oh, do I really need to worry about it? Why are we talking about it? I've only heard about big diseases. So why should I worry about it? I don't think I have a problem, kind of thing. But yes, anemia in pregnancy is a very important topic. I know we do think sometimes, no, I wouldn't have it and I don't have it. But the world data says that about 60% of the pregnant women, even in the developed countries, are anemic. So when we are anemic, there are going to be issues, and that is exactly why I thought let's discuss about this today, and let's take it further so that we can look at a better health, everybody. So we all know that a healthy mom is needed, or a healthy body, or a healthy mother is needed to produce a healthy baby. We know that it is the mother who gives all the nutrition supply to the baby while the baby is in utero. So if the mother is healthy, we can expect to have a healthy outcome from the pregnancy. If the mother is herself malnourished, we know the baby may not be getting enough nutrition, and therefore it can be a problem. So that is why we thought let's choose the topic anemia and let's talk about it. To the extent that what is the significance of anemia when I say 60% of the people are malnourished in the are anemic even in the developed countries, in the developing countries, and when we look at our kind of scenario in the rural world, probably rural part of our country, maybe about 80% of the women are anemic. For this same reason, this year's our motto as obstetricians is that reach the red. Let's build up the hemoglobin. Let's reach the red. That is what we want to do, so that we can have more and more healthier mothers. And when we have healthier mothers, not only is she healthy, obviously she's going to bring out an healthier baby. So, what is anemia? Anemia is basically when your hemoglobin content in your circulation is less than 12 grams per deciliter. So, by the WHO definition, most all of us, for women and men, it is different. And the hemoglobin for women should be between 12 to 14 grams per deciliter of blood. However, we find that we have most of our women are somewhere between 10 to 12. We have classified the anemia therefore as mild, moderate, and severe. When we say mild, we are like, okay, maybe between 10 to 12, we would call it as mild. 8 to 10, we will call it as moderate, and less than that is considered severe. And when it is less than 6, we are very, very worried on this mother, and the outcome of the woman and the baby is not going to be very, very great unless we correct it quickly. Now, what does hemoglobin do? Hemoglobin carries all the oxygen from your hemoglobin is the cell which carries the oxygen. Like when we breathe, there is circulation happening. We have the air going in, and we breathe out carbon dioxide. This is basic science. Everybody knows basic biology. Everybody knows. So, what hemoglobin does? Hemoglobin is that cell which will pick up the oxygen there from there, and it catches the oxygen with it, and then this goes in the blood circulation everywhere. So then now this is the one which is going and giving the hemoglobin to my lungs, to my kidney, to my brain, to my heart, to my hands, to my legs, to every part of the body. It is this hemoglobin, these red blood cells, which are catching this oxygen and giving it to every part of the body. So obviously Obviously, if you are deficient in hemoglobin, if you are lesser on your red blood cell count or your red blood cell hemoglobin content is low, which means you are anemic, the amount of oxygen that you are carrying and taking to with the organ wherever it is needed is on the lesser side. So I have lesser input of food, I can give a lesser output of food. So I have lesser hemoglobin, I can't carry enough oxygen with me, so I can't give you enough oxygen. So my uterus gets lesser oxygen, my uterus gets lesser oxygen, my baby gets lesser oxygen, my baby gets lesser nutrition, my baby would not grow well, kind of a thing. So that is the significance of anemia in pregnancy. We know that anemia in pregnancy is something also physiological, and there is something called pathological. Like we all understand that during the pregnancy we are going to have weight gain, we are going to have increased circulation of blood. Our body mechanism is so amazing that if a normal adult woman has 4.5 to 5 liters of blood during pregnancy, this becomes almost 6 liters of blood to allow more towards the baby to cope up with the stress of the pregnancy. It becomes almost 6.5 liters of blood. So because there is some amount of increase in the blood, where it's not just the red blood cells, even the water in the blood, the liquid part of the blood, the plasma, everything increases. Therefore there is something called a physiological anemia, in the sense that suppose I started my pregnancy with an hemoglobin of 13, I'm continuing to eat everything healthy, I'm having all my supplements correctly and everything is going good, I'm meeting my required nutrition for the pregnancy. Even then, by the time I'm ready for the delivery, because of the increasing blood volume per se, the hemoglobin might have dropped by about 1 gram, which means to start at, if you're 13, by the end of the pregnancy, I may be at a 12 despite of everything being good. Also, we know that during the delivery process, every woman loses blood during the delivery, whether it be a normal delivery or whether it be a cesarean section. The amount of blood loss is a little more in cesarean sections, but any woman can have more blood losses. And therefore, when we have already an anemic status, postnatally also we would be sick about the whole thing. We'll come to the postnatal aspect later. So basically, when you're low on the hemoglobin, there, like I said, it can be physiological and it can be pathological. Physiological is when there is just the normal hemodilution. Pathological is when it is much more than what is required, or you've already started with a low hemoglobin and so it has become further lower, which means to say that there is a deficiency of hemoglobin in the body. Like I said, mild is when your hemoglobin content is less than more than 10 grams but less than 12 grams per deciliter. Now, hemoglobin is basically a protein which is there in our blood, and this has various needs of its own. It needs various kind of things to build itself up. And red blood cell can survive in our body for about 120 days, its half-life, which means our body is continuously producing red blood cells and continuously the red blood cells are dying out. In this, hemoglobin is one of the components of the red blood cells. And to build up this heme protein, we need a lot of things. We need iron, we need vitamin B12, we need lots of enzymes, and then there is, like everything else, the gene, the script which writes what it is going to be. So the most common reasons for being anemic are these: either you're iron deficient, or you're B12 deficient, or your genetics is not okay to give the right amount of hemoglobin, or you're not building up as much as hemoglobin because of a disease somewhere else, or you're burning off more hemoglobin than what can because of some metabolic errors, or you're bleeding and losing blood. Okay, so all these things will end up with a lower hemoglobin. The commonest cause of low hemoglobin is an iron deficiency anemia. Iron deficiency anemia is the commonest cause in our country, and therefore, when we see a woman who is low on her hemoglobin, the most common thing we worry about is think about is an iron deficiency anemia. Because we know iron deficiency anemia is very common in our country, as a routine, even if your hemoglobin when you book with your doctor is around 13, most of your doctors would still prescribe you an iron tablet so that we can look at not getting deficient in iron. This is because most of the women have a relatively lower reserves of iron in their body because of nutritional deficiencies, or because of the fact that they're bleeding heavier during the periods, or the periods are shorter and bleeding longer days, or coming very frequently. Therefore, they are always, almost always deficient in the iron stores in our country. And therefore, even if you start at a hemoglobin of 13, we know as the requirement in the pregnancy is going to increase, we do go ahead and start you off on the iron supplements. Okay. The second reason is the B12 deficiency, which we'll come to later. later. Now, so like I was trying to say, why we need to have a good hemoglobin. You will say, doctor, it's just a number. Why should I worry about it? Why should I take the iron supplement? It gives me severe gastritis. I feel like vomiting. I feel very metallic taste in my mouth. I can't eat anything. If I'm not getting enough hemoglobin, if my baby is therefore then getting lesser oxygen supply, the baby will not gain weight as much as it is supposed to gain weight. So if by my genetics, if my build, if by my nutrition, my baby was supposed to become 3 kgs or a little bigger than 3 kgs, which is the normal average weight of our babies in our country, because of being anemic, this baby is now going to get lesser nutrition. And if this baby is going to get lesser nutrition, it will not grow it to its full potential. In the sense, instead of having a 3 kg baby, we may land up with a 2.8 or a 2.7 kg baby. So we don't want our babies to be born smaller. We don't want our babies to be born underweight. We don't want our babies to be malnourished, because they will also come out with their own health issues if they are malnourished. Similarly, it has been proven that if the mother is anemic, the risk of this mother developing an early labor is higher than a mother who is having a good hemoglobin. Right? Therefore, again, it is important for a mother to have a good hemoglobin so that we can look at the pregnancy going till term, and we can look at this baby coming out as a good weight baby. Also, it has been proven that the brain development of the baby starts off from as early as conception. But when we look at the IQ development of the baby, this probably starts somewhere around the 6th month of the pregnancy. And there is a rapid increase in the IQ or progression or development of the IQ in all babies between 6 months of in utero, that is while you're pregnant, to the first 2 years of life. That is why you see all these ads talking about nutrition for young mothers, nutrition for mothers, nutrition for lactating mothers, giving this supplement to the baby, giving that supplement to the baby, because it is up till the first 2 years of life where there is a rapid improvement in the brain development of the baby. That's the most crucial phase. So the foundation of the future brain of the baby has started as young as 6 months of the pregnancy. So if in the first 6 months of the pregnancy, if you're finding that the hemoglobin is low in the mother, the baby is also going to have lesser reserves of iron. The baby is also going to be anemic, which means to say then this baby may not be as smart in its IQ as compared to any other baby whose mother was with a hemoglobin of 13 or 14. Now, what is this meaning to say when I say IQ? It means to say your memory, it means to say your concentration levels, it means to say how quickly you understand and grasp things. So, suppose you have a good hemoglobin. I read something, I'm able to understand it, I'm able to uh, within one reading I can grasp it, and I will have a good memory of this later on, and I will be able to utilize it later on. Tomorrow, if I have a lower hemoglobin, when I'm trying to concentrate and read the same thing, probably I cannot grasp it at one go. Probably I cannot concentrate for those full 20-30 minutes that I need a concentration. There will be a fleet of thoughts, I will get lost into something else, and therefore I will not be able to grasp things better. So my memory power will be lesser, my build up on understanding things will be lesser. So the same thing that I can read and understand and get a good thing in half an hour, for somebody who is low in the hemoglobin may take 1 hour, may take 2 hours to grasp the same thing, understand the same thing, and to be able to memorize and reuse it later on in life will be lesser. Which means if my baby is low on the hemoglobin, tomorrow my baby, when they go to school, even after sitting with the books for 10 hours, will probably not have learned as much as a baby which was born to a mother with a good hemoglobin will learn within 1 hour, kind of a thing. So that is why, as a mom, it is very important that you give your baby a good foundation for the brain of the baby, so that this kind of a memorization or concentration levels on the baby are better. Yes, we can build up the hemoglobin on the baby later on, but I think everybody of us will understand that if the foundation isn't great, the upper stories are not going to be great. You have a 10-story building, foundation is weak, you might invest whatever in the top floors, you will probably not get as much results as if you start off with a strong foundation. Foundation is foundation, that is very important. And the foundation for this in the baby starts from 6 months of pregnancy onwards. Also, when it comes to physical activity levels, now suppose I have a good hemoglobin, I have a good stamina, I can continue to work even for 14 hours in the day. I have a good hemoglobin, I can run a running race, I can run a 10 kilometers and not get tired. But if I have a low hemoglobin, I run 10 steps and I'm like, oh my God, I'm running out of breath because I don't have enough oxygen. There is no, my blood is not able to carry the oxygen from my lung to the other parts of the body. So my legs get tired, I cramp on my legs, I'm exhausted, my brain is tired, and I'm like sleepy all the day. I can't really work. So a good hemoglobin is therefore necessary, not just for mental faculties, it is also necessary for the physical development of the baby. That's exactly why I said, suppose you're low on the hemoglobin, your baby being born, instead of being born 3 kgs, will be probably born just 2.7, 2.8 kgs. So this is something which I'm sure none of these mothers, none of me as a mother, none of us as women will want to have our babies born underweight or have them poorly developed just because something I could have done. So, like I said, iron deficiency anemia is the commonest cause of anemia in our country, and therefore we start off the iron supplements regularly for everybody. The way we come to know that what is the cause for your first thing is we do a hemoglobin when you come to us. With the hemoglobin, we know what your hemoglobin level is. When we do the hemoglobin, there are other parameters in the blood that we look at, which tell us to get a good idea to know whether it is just iron deficiency or whether it is something else which is causing a low hemoglobin, which could be sometimes a B12, which could be sometimes a folic acid deficiency, and which could be other rarer kind of conditions which can cause a low hemoglobin. Now, coming to B12 deficiency. B12 deficiency, when we have an iron deficiency anemia, we have a classical picture of something called microcytic hypochromic, in the sense all the cells are smaller than what they should be. Hypochromic means they don't look as dark as they should be, right? So this is what is microcytic hypochromic anemia. Now we have the next common reason of anemia in our country, which we see more often in the urban population, is a B12 deficiency. We also, it's more, not more exactly in the urban population, it is basically pure vegetarians which are B12 deficient. However, people who eat non-veg can also be B12 deficient because of not enough stores, because of not eating enough non-veg, or because of poor absorption from the gut, or because of poor utilization by the body. Now, vegetarian food doesn't have much sources of B12, and therefore, pure vegetarians would be B12 deficient. Now, when you have B12 deficiency, B12 is again one of the important things which is needed for the hemoglobin or the heme protein to be formed, so that it can be there in the RBC, so that the RBC or the red blood cell can carry enough oxygen from the lungs to every part of the body, including when we are pregnant, the uterus or the baby inside the uterus is treated like an organ in the body, right? So, B12 deficiency presents a little differently. B12 deficiency, the common symptoms would be that mothers would present with a lot of tingling sensation in the hands, tingling sensations in the legs, a little crampy sensation. Burning feet is one of the common symptoms that you can be. Poor quality of skin, poor quality of hair, and when we test, you might be showing up as B12 deficiency. In the sense, first you will show a low hemoglobin, and when we look at those cells, this is little different. Like I said, when it is iron deficiency, they are smaller cells, lighter looking cells. B12 deficiency cells are bigger cells and they are darker looking cells, even though they are deficient in hemoglobin. So that is what we call as megaloblastic, in the sense they're bigger cells kind of thing that we see when we are examining a B12. Now, common, you can have only iron deficiency, you can have only B12 deficiency. But you can have a mixed group of infection, in the sense mixed group of anemia. You can have both iron deficiency and you can have both B12 deficiency. And therefore, when we look at the blood pictures, sometimes it is very confusing to get it to a diagnosis unless we do something called a peripheral smear, where we study the cells individually and see how they are looking. Then we get a better idea what are we dealing with, right? Now, so when you present and when we examine you and we do your hemoglobin content, we are not only do just in hemoglobin, we look at various parameters in that, and based on that, if you are turning out to be anemic, we first start off the iron supplements because iron deficiency is the commonest reason, and then based we get send all the tests, so we know whether you are iron deficient by doing a blood test, or we also send off the B12 blood test, so we know how much B12 content is there. So we would know whether you are also B12 deficient, and with that we would know what we are dealing with. Similarly, folic acid deficiency is also one of the reasons for anemia. Though luckily enough, most of the women eat decently good enough amount of dietary folic acid, and everybody now is almost everybody is aware of the role of preconceptional folic acid. So we rarely see really folic acid deficiencies unless women are on certain kind of drugs which prevent absorption of folic acid, or they have had bad tuberculosis, or they're diabetic wherein the requirements are much more different, and therefore we may have it. So generally folic acid deficiency is something which we don't test to see when a woman comes to us with anemia in our pregnant status. We only probably go ahead and do the iron and the B12 levels. Now, these are the nutritional causes for deficiency. Like I said, B12 is there only in non-vegetarian food. Now, coming to what dietary changes you can take or lifestyle changes that you can take to improve these nutritional deficiencies so that you're not anemic. When we look at iron deficiency, basically iron-rich foods are palak, methi, all the green leafy vegetables, all the suppos basically that are there, all the green leafy vegetables, not just greens. It's not beans and bindi. It is palak, methi, and we find so many more leafy vegetables in our country like sarson ka saag खा सकते हो, या in the south like we get a lot of drumstick and other kind of leafy vegetables. These are all the rich sources of iron. Other than that, beetroot is a very good source of iron. Along with it, drumstick is a very good source of iron, including the drumstick leaves. Among the dals, it is mainly Bengal gram, the black chana, which is a good source of iron. Uh, Changing over from sugar to jaggery, it's a very good idea when you're iron deficient. Jaggery is probably the healthier sugar than normal white sugar or brown sugar. This is a misconception that people have that brown sugar is rich in iron. No, the iron content is the same whether you take the normal white sugar or you take the brown sugar. The brown sugar is just lesser purified or lesser stained out. The staining of the sugar has not been removed, but the iron content is not any better in brown sugar. So if you are looking at improving your hemoglobin by natural dietary things, change over to using jaggery instead of using the normal sugar kind of a thing. Among the fruits, it is apples, pomegranates, which are very rich source of iron. So try to include these things again regularly into your diet. Among the dry fruits, it is usually the dates, figs, and kishmish, raisins, which are very rich source of iron. So try to include these things regularly into your diet, right? Among the other things, it is the non-veg. The liver part of the non-veg is what is the richest source of iron. So when we are looking at improving iron deficiency, or we are trying to prevent iron deficiency anemia, when we are looking at a healthy mom, these should be there regularly in our diet so that we can look at better hemoglobin. Yes, we may need to continue to take iron supplements. Like I said earlier, that there is a component because of the hemodilution, because of the increasing volume of the blood, and there is a component because of the fact that there is an increased requirement for the baby, and therefore, and we are lower on our iron stores generally. So that is why Indian women need to be taking iron supplements regularly in the pregnancy. Now, what are the natural sources of B12? Like I started my lecture about the B12 saying that non-vegetarians do not have generally would not have B12 deficiency. Pure vegetarians would have B12 deficiency because vegetarian food does not have a great source of B12. For the vegetarians, it is probably only some amount of walnuts and pumpkin seeds and dairy products which have not really great amount of B12s. The non-veg, anything in the non-veg has got good amounts of B12. So that is the natural source of B12 for people who are anemic because of B12 deficiency. Now, yes, when you are very deficient, it could be, like I said, not just because you're not eating enough, maybe because you're not absorbing enough, maybe because what you're absorbing is not being taken care of sufficiently. So therefore, when we find extreme levels of B12 deficiency, we go ahead and give the injections of B12 along with the tablets of B12. Again, this is just a blood test which will let us know whether you're B12 deficient. So the test that can be done for that is a blood test, which is usually run as a fasting blood test, which will let us know how much is the B12 deficiency, right? Now, the other reasons that one can have problems is common reasons is you are eating well, you're absorbing everything well, but you are bleeding somewhere or the other. Bleeding somewhere or the other, maybe because you're vomiting through the pregnancy and therefore you're retching out a lot of blood. Maybe you have got infection anal fissures, which means you're constipated and your potty area is torn up, and therefore when you pass motions you're bleeding in your motions. You might develop piles during the pregnancy, the hemorrhoids, because of which then every time you go to pass motions you might be passing blood along with your motions. So though you are eating good quantities, you are losing out a lot of blood through these blood losses, and therefore you might have a low on your iron stores and low on your hemoglobin. The other common problem that we find where we find a low on the hemoglobin is because of presence of worms in the intestines, right? The absorption of iron happens from the intestines, and having worms in the intestines with the kind of lifestyles that we have is not very rare. We do find worms in intestines, the rural population definitely. Hand hygiene is one thing which is very important to prevent worms. Also, similarly, when you are in the urban area, maybe because we eat out a lot, maybe because we almost everybody has a cook at home who may be handling all of our food and who might be carrying the worms through her nails and getting them to your house, or you might have toddlers at home who are going to school who play outside in the sand and come back. So these worms which are there in our intestines pass eggs which come out in our motions, and then when we handle motions, when we handle play in the soil, when you have long nails, these eggs all get deposited under there. And then when you are handling your food with it, and then when you eat food or while cooking the food, the eggs have gone there. This now when you consume it, they go there and grow in your intestines, and then you are having worms sitting there. I am eating food, my worms are eating off my food. I am getting only this much because the worms are stealing off their share. And the more food they get, the more they multiply, the more they multiply, the more amount of food they eat off for you. So when you are also found to be deficient in iron, we also go ahead and deworm you, which is usually done only after the third month of the pregnancy, the deworming medications. But not everybody requires a deworming, where very obvious symptoms would be there when you are having worms in the stool. The commonest symptom that you would be presenting would be feeling very bloated all through the day, or the most common symptom is when you have pinworms, wherein you feel like you're itching on your potty area, or you feel like something is crawling up in your potty area. So these could be pinworms, which you can also see as small worms seen in your emotions. They're usually very small, thin, thready like worms, or sometimes you can have long cylindrical worms, which are called the ringworms, or you can see tapeworms, which are all, but most common is pinworms in our country, which causes these deficiencies. So deworming may be also important, and that is why, pediatricians continue to deworm children regularly. Also, you need to remember when we are looking at deworming, the whole family needs to be dewormed together. Suppose I only deworm the mother, the father is still carrying the same eggs in the nails, and then the mixing of food happens and everything happens, and you get the worm infection from there. And an ideal would be when you are deworming, not just deworm husband, wife, if you have children at home, if you have housemates at home, if you have a cook especially coming in, go ahead and deworm all of them so that you can look at a better absorption of your food, what you're eating, rather than giving it to the worms kind of thing. Now, the other reasons why you could be anemic is then there is something called thalassemia. This is what I said, your genetics or your script, right? Everything is pre-decided in our body. We have genes which are there, which decides what we are going to be. It is the genes which decides the color of my hair, the genes that decides how tall I will be, it's the genes which decides how my skin is going to be, the color of my eyes, everything is scripted. Okay, that script is there and the script decides everything. So for the formation of hemoglobin, the script is there which forms how much, what kind of hemoglobin should be formed or heme protein should be formed. Now suppose there is a problem in the script, then probably the hemoglobin would not form correctly, and this is what we call genetic causes of a low hemoglobin, of which the most common in our country is thalassemia. Among the thalassemias, it is the beta thalassemia which is the commonest one. Then you have the alpha thalassemia, then we have the E trait, and then we have the Punjab trait, various forms, various components of the protein that can go wrong, which can cause the low hemoglobin. Then there is something called sickle cell anemia, which is again genetic and can be there kind of thing. Though the sickle cell anemia sometimes can be because of some rare drugs, but usually it is because of a genetic cause. So what is it when you have a beta thal or you have a thalassemia? Thalassemia is basically decided by genes. Luckily enough, thalassemia is a recessive disease. recessive condition in the sense that unless both the genes are defective, you don't show a full blown disease. If you have only one gene defective, you will be low on your hemoglobin, but still hovering somewhere around 10, not really very low. And when we do the test, you will show us that yes, it is there in the trait or what we call as beta thal trait kind of a thing. Suppose both your genes are defective, you are never going to produce a good amount of heme protein, and therefore you will always be anemic. And most of the people who are thal disease, what we say when both the genes are affected, will be very, very low on their hemoglobin and will need repeated blood transfusions. But those who are only thal trait will not be very much affected and will be okay. The significance to know whether you are thalassaemic or not is, suppose by chance both you and your spouse are thalassaemic. In the sense, thal trait, you both have one gene which is defective, one gene which is healthy. Now the baby takes one gene from you one gene from the spouse. So now you might have one unhealthy gene and one healthy gene. The spouse may have one healthy, one unhealthy. Now, if the baby unfortunately takes both the unhealthy genes from you and the father, you will end up with a very sick baby with a full blown disease of thalassemia. Suppose the baby gets one unhealthy gene from you and a healthy gene from the father, or the healthy gene from you and the unhealthy gene from the father, the baby would continue to be a trait. Suppose the baby gets both the healthy genes from you and the father, then the baby will be totally disease free. So therefore, we need to know what your when you're low on the hemoglobin, we need to know whether you're thalassemic. And if we find that you're thalassemic, we also run the test on the spouse to know whether the person is also thalassemic. And if we find the person is also thalassemic, then, like I said, the various permutation combinations possible. So there is a 25% chance that the baby will be fully normal, 25% chance that the baby may have full blown disease, and a 50% chance that the baby will be having a trait again, kind of a thing. So again, it becomes important, though in our country as yet hemoglobin screening for thalassemias is not a compulsory test, but many of us tend to do this test early enough in the pregnancy, or many of us tend to run these tests as soon as we realize you're becoming anemic, kind of a thing. This is again got genetics, and there are huge pockets in the country where we find thalassemia. Gujarat has one of the big pockets. Then the Sindhi migrants do have a big pocket of thalassemia. And then we have the Orissa and the West Bengal belt where we do see thalassemia because of genetic causes. Though there, the more common thing we see is an hemoglobin E trait rather than a beta hemoglobin. And then we have the population over the south also. So practically, when we start investigating, we find that almost everybody can have the genes for thalassemia. There is no particular. Earlier, we used to say it is only this pocket of the country has it, but now we are finding maybe with the mixed culture, maybe with whatever else, we are having enough of thalassemia coming in. The other reason why you could be low on your hemoglobin is, suppose you are having malaria or dengue or losing blood because of those kind of things. So at the end of it, what is important is that you should have a good hemoglobin so that your baby can have a good, healthy, nutritious startup. The foundation should be good. If the foundation is good, the baby will be good. Other than this, that the baby will be undernourished, the baby may be poor on its IQ, the baby may be underweight, and you might land up with a preterm labor. From the maternal point of view, why it is important to have a good hemoglobin is it has been proven mothers who are anemic have a slight increased risk of developing high blood pressures during the pregnancy. Like I said during the initial stages of the lecture, that every woman loses blood after the delivery, during the delivery. If you're already lower on the start off, then when you bleed, and if by chance you bleed even slightly heavier, your hemoglobins will drop drastically. And if your hemoglobins drop rapidly, then you will not be able to manage yourselves. You will not be healthy body to take care of your baby. You will be tired all the time. If you're low on the hemoglobin, you will not produce good amount of milk because you're tired and exhausted. Therefore, mothers, please pull up on your nutrition. Make sure you're taking healthy diet. Make sure get your hemoglobin tested before you plan your pregnancy. If you're deficient on the hemoglobin, go ahead and meet your doctor. Get yourselves tested to know what is the cause of the hemoglobin being low, whether it is a low on the iron, whether it is a low on the B12, whether it is a genetic cause, or whether it is any other reasons because of which you're losing a lot of blood. Get that corrected and then plan the pregnancy. So remember, reach the red. That is our motto, so that we can have a healthy mother and a healthy baby coming in who is not pale, who is not anemic, who is healthy, and we have a good outcome about your pregnancy. I would be open for questions if there are any questions. Otherwise, I think we will conclude. Thank you.